Hello, everybody. My name is Olivia Fernandez, and my research topic was RD facilitated nutrition education and intervention in conjunction with resistance training 3 times per week in inpatient addiction rehab facilities. So this is a program I have designed called Recovered Wellness. That is a service that will be provided at inpatient addiction rehab facilities that goes in collaboration with their protocols and their treatments that they go through to provide more services for their patients. So nutrition and moving our bodies is vital in order for us to survive. Rehab facilities have a big focus, obviously, on mental health and the therapies that they take their patients through. But a lot of them actually do not utilize a registered dietitian or a personal trainer, exercise physiologist. So there's a multitude of studies that show the detrimental effects of poor nutrition and lack of physical activity and the correlation to mental health, which is also a correlation to substance abuse as well. And on the flip side of that, there are a lot of studies showing that people who suffer from addiction are also depleting themselves. They have a lot of deficiencies, a lot of malnutrition. So it works on both sides as well. So inpatient substance abuse treatment centers are mainly focused on those mental therapies, providing limited or no nutrition and exercise resources to patients. So this is how the Recovered Wellness Program came about. So the purpose is to show that a registered dietitian and either a personal trainer, exercise physiologist implementing a nutrition and physical activity routine in inpatient rehab facilities will see an increase in adherence to recovery, improved overall well-being, malnutrition markers, fitness assessments, and mental health status, leading to improved quality life post-rehab, meaning that they are not re-entering into rehab and they're able to adhere to their abstinence. So the methods, this study is a randomized control study. There's 2 different groups, the control and the experiment. The experiment group is going under the Recovered Wellness Program. It's very important to note that both groups are still adhering to the inpatient protocol, the therapies and all the treatments that they have to go through. The ones in the Recovered Wellness are just in conjunction with that, going through this as well. So down here on the bottom left-hand side, I took a typical schedule of a rehab facility so you could get a bigger picture of exactly how this would fit in. And as you can see that there's time slots, 8:30 a.m. This allows the treatment group to receive a resistance training session. There's room for them to meet with the registered dietitian. And then there's a nighttime group as well. This will be, flexible and changed as it needs to fit into any rehab facility. On the right-hand side, these are what the malnutrition markers and the fitness assessments that are going to be looked at in order to see improvements of each patient. So that way we're not only just going based off verbally what they're saying, but we can actually see some data that gives us specific results. So for the results, the experiment group in the study saw significant improvement in the malnutrition markers and fitness assessments, along with self-reported improvements via surveys. So at baseline, 4 weeks and 8 weeks, they're actually receiving not only just are we testing the malnutrition and fitness markers, but they're receiving a survey to make sure that they feel like they're improving and to see exactly how they feel as they're going through the Recovered Wellness Program. Also, the control group is receiving the same exact malnutrition fitness assessments at the baseline 4 week, 8 week, and then at the finish. And they're also getting those surveys as well. So the control group did not have significant improvements in malnutrition and fitness assessments. So this table right here is showing post-rehab, 6 months post-rehab. So as you can see down here, you have the no's and you have the yes, control and experiment group. So the experiment group had a more likely chance to not return to rehab. So also there was 200 subjects that were included in this study. There is a 30.4% chance, like a dropout rate for inpatient rehab facilities. So with the 200 subjects being included, even if we have a little bit over a 30% chance of a dropout rate, we're still able to have a significant sample size. So with this post-rehab, the ones that we were able to ask and get results back from, that there were only 20 for the experiment group and 14 for the control group out of 70 subjects. So that's also a low rate too, but we were able to get some data from that. So as a conclusion, this study is used to show the importance of implementing nutrition education, counseling, and exercise techniques to further improve addiction patients and see abstinence long-term. Recovered Wellness, as part of a substance abuse treatment center, aimed to further confirm that the increase in nutritional and physical activity education would increase a patient's ability to resist alcohol and drugs long term. Future research would benefit from more specific nutrition and exercise, for example. This was a very vague topic. It covered a lot. And as I went through this, I realized that it would be more beneficial to have more specific data. So for example, only looking at one form of nutrition intervention, or only looking at the resistance training specifically to see exactly how those affected the numbers. So yeah, thank you guys for listening.